This section is to provide you some information about the initial postoperative exercises. The first exercise is the neck exercises. We do this to stretch out the neck, typically because people will get pretty sore from wearing the sling for a long period of time, especially up in these muscles or these muscles. To do this, I'm going to have you turn to the left. This is left rotation. Lindsay, let's have you turn to the left twice. This is right rotation, turning to the right, 2 times like that. Then you have lateral flexion of the neck, ear to shoulder, twice like that. This will especially stretch out these muscles. Right rotation, or right lateral flexion, sorry. Flexion of the neck, let's bring the neck down, twice like that. And extension of the neck. Extending the neck is simply looking up at the sky. If you have neck problems, be sure to be aware that you don't create any pain with this exercise. If you do, it's not necessary to do it. The next exercise is the assisted elbow flexion. Grab the arm and assist your arm into elbow flexion. This is elbow flexion. Typically, the biceps will need to be active to do this exercise. One more. To do this exercise actively, you simply take away the hand and you allow the arm to bend on its own. Again, this will assist with a pumping action that pulls the swelling out of the arm and helps to keep the bicep muscles active. The next exercise is hand, wrist, and elbow movements. Lindsay, let's have you hold your hand like this. Activity is allowed in the wrist and the elbow. To move the wrist, going to extend the wrist, pull it back, flex it, back and forth like that. Turning the wrist. And opening and closing the fingers as if you're making a fist and relaxing. The next exercise is the ball squeeze. You'll be provided with a ball on your ultra sling. The purpose of the ball is to pump the arm muscles, so we hold this, so that any edema or swelling that comes down into the arm or the hand gets pumped out of the lower or the upper extremity. Go ahead and pump the ball. There's no limit to the amount of repetitions you do with this. You can do this all day long if you like. Again, it's to pump the swelling right back out of the arm toward the heart. The next exercise is the pendulum. To do this exercise properly, you let your arm hang and make small circles. You're going to use your body weight to make the circles as to not activate the rotator cuff muscles. So simply just sway forward and back. Oftentimes this exercise will help with pain relief and is a nice warm-up to any of the passive or active exercise you do as a part of your postoperative rehabilitation. The next exercise is the ankle pump. The purpose of the ankle pump is to prevent deep vein thrombosis. That is a D.V.T. A D.V.T. is a blood clot that may form in your calf muscle. It's very dangerous because if you do get a D.V.T., it could become loose and create a pulmonary embolism, which is a blood clot that would go up to your lungs and could be fatal. So what we ask our patients to do, as much as possible, is to place a TheraBand around their foot, hold with their uninvolved arm, hold tight, and Lindsay, let's have you just pump your foot up and down. By pumping the calf muscles, you pump blood through the calf muscles and create an increased amount of circulation as to keep blood clots from forming in the calf muscles. This exercise can also be done without TheraBand. Let's just have you pump. And with an increased amount of walking, this will also help to to increase the circulation of the calf muscles as well. So this is also encouraged.
So Lindsay, let's talk a little bit about DVT prevention. So we talked about that in the post-op exercises. We did your ankle pumps. That's where you were moving your feet up and down, either with or without the TheraBand. And that's going to help promote circulation in your lower extremities. Other things, you'll be provided with a pair of TED hose. Those are those white stockings that you got right after surgery that you woke up with. We'd like you to wear those for at least 10 to 14 days. And anytime you're going to be traveling in the car or on an airplane for long periods of time. And of course, we're going to try to start you on some type of cardiovascular exercise as soon as possible, and that will also help promote circulation, whether it be walking or riding a stationary bike. You may not want to do anything too jarring in the beginning because you did just have shoulder surgery. And those are things that will help prevent deep vein thrombosis.
Next exercises we're going to go over are passive range of motion exercises. Passive range of motion means that you're not using your muscles as we do the motion for you. The reason we have you do these exercises to help increase range of motion, move the joint so that the synovial fluid circulates inside the joint, thus promoting nourishment of the joint and promoting circulation of the tissue surrounding the joint. The next exercise is passive external rotation. To do this, you have your patient lying on their back with a towel support under their arm. External rotation is the motion where you move the shoulder outward like this. You see that the humerus bone turns on an axis while you don't abduct or elevate the shoulder. So it goes just like this. We measure external rotation starting from here with the fingers pointing up toward the sky at 0 degrees. This is 0 degrees. If we move out externally just a bit, this is 30 degrees. This would be 45, 60, and 90 degrees of external rotation. While doing this exercise, be sure that your patient does not guard with their muscles, contract their muscles, or have any major increases in pain while doing the exercise. As we move the shoulder to the inside, this can be considered internal rotation. So internal rotation and external rotation can be combined during this exercise. An alternative to doing the exercise is to actually take the pillow away or the towel roll and sit next to the patient, have their elbow right on your thigh. You can place your hand on their shoulder for support or keep it here and externally rotate. And that's external rotation in a passive range of motion. The next exercise we'll do is forward elevation. From here we can take the elbow, hold on to it firmly, and bring the arm into forward elevation. Again, it's important that the person does not contract their muscles while doing this exercise. Sometimes it's helpful to have a bend in the elbow, pull the arm close, and maintain some contact with the glenohumeral joint, just like this. Again, if you feel that the person is contracting their muscles, simply stop, let them relax, and then continue with the motion. Be careful when you're lowering the shoulder, as lowering the shoulder is an anti-gravity motion. When you lower a shoulder, the person has a tendency to contract their muscles. When they do this, this will probably create a bit of pain in the shoulder. So be sure that you're slow with the lowering motions and very supportive. From this position, we can go to abduction. Lindsay, I'm going to have you hold on to my arm. Lindsay's holding on to my forearm here. I'm holding on to her elbow, one hand here, and we bring her arm into abduction like this. This motion, again, is called abduction. Abduction means to move away from the body. Don't help me too much. Good. Be sure not to just let go of the arm. Hold on to it firmly. Position of support. And help your subject, patient, friend, spouse back into a comfortable rested position.